So should we be using digoxin? And digoxin's a drug that's it can be used for heart failure. It can be used for atrial flutter. It can be used for atrial fibrillation. So that's what usually atrial issues is where digoxin has been used. This is Diamond Fernandez with the HeartFit Clinic, your leaders in heart health. And today I'm going to talk about should we use digoxin. So there was a study that was done, and it was done. It was actually, so digoxin's actually, it's got a big X against it. A lot of medical doctors talk about it being not a good drug to be used. And anyway, it was a quite a large trial that was done with 6,800 patients, and patients with systolic heart failure and normal sinus rhythm, and they gave them digoxin, and of course there's a placebo group, and all-cause mortality was nearly identical in both groups, but the patients that were treated with digoxin actually had 28% lower rate of admission to the hospital for heart failure. And so, I don't know, should you use digoxin to improve heart health? Well, in my opinion, if it doesn't have any benefits on that, then, I think there's a lot more that you could possibly do. That's my opinion, but make sure you talk to your healthcare providers and ask them, because everyone's situation is a little bit different. But I just wanted to share this study for you because a lot of people are giving up on using digoxin, and in this trial it's evidently beneficial in minimizing hospital readmissions from heart failure, because the heart failure symptoms, and it might be something to consider, maybe end stages or whatnot. But anyway, there's some actually good other drugs that are out there, and I don't want to talk about on this talk here, but just make sure that you talk to your healthcare provider. I just wanted to share the data with you and show that it does minimize readmission rates, but doesn't make any changes to mortality changes. And so I know digoxin, or dig is really what they call it in the medical community, it's got a bad label to it, and rightfully so. It's got a lot of effects to it, but maybe the sicker patients may consider it to minimize hospital admission. But more important than that, make sure you focus on your risk factors and exercise and nutrition and all the good things that you can do. ECP therapy in the right patient as well would be benefit for that too. So anyway, Diamond Fernandez here from the HeartFit Clinic, your leaders in heart health, wishing you to live happier, healthier, and longer.